Elizabeth Foss, occupational therapist, has been practicing for 11 years and specializes in working with the neurological populations with a passion for serving those with cerebral ataxia and Parkinson's disease. She is the YouTube content creator for the channel Little Steps, Big Gains, in which she provides free resources with educational videos and exercise programs for neurological and older adult populations. Elizabeth is certified in LSVT BIG, Otaga, stroke rehabilitation, and Tai-Chi. She is also a certified functional aging specialist and an older adult exercise consultant. In her spare time, Elizabeth loves watching soccer, taking her 3 dogs to the park, and rollerblading by the lake.
Thank you so much, Jessica. Let's open up our presentation. All right, so today we're going to talk about balance stability, balance training in Parkinson's disease. Jessica, thank you so much for that introduction. I did go ahead and input, everything you said here, just in case, a little bit about me. Our agenda for today. Part 1, we're going to discuss the balance strategies and systems that contribute to our postural control. In other words, what makes up our balance, right? We're going to examine how Parkinson's disease affects these balance strategies and symptoms, specifically to Parkinson's disease. Part 2, we're going to review evidence-based interventions that combat balance loss in Parkinson's disease. Part 3 is going to be free resources. In between each part, we'll have kind of a therapeutic rest break where we can move around and do some Tai Chi. And then we're covering a lot of content. So feel free to write down any questions, put them in the back of your head, and then you can hopefully re-listen to the re-recording for review, or we'll have some time for Q&A afterwards. Okay, so part 1, our balance strategies and systems. Okay, in other words, when people ask me, what makes up my balance? We're going to start with the 3 balance strategies. We'll talk about what they are, and then we'll talk about the effect that Parkinson's disease has on these strategies, okay? So first off, a balance strategy. It's basically a postural reaction to a loss of balance. When we lose our balance, how do we regain it? We do 3 things. First off, we use our ankles, so an ankle strategy. There's a hip strategy, and there's a stepping strategy that we use. Our ankle strategies are our first line of defense. We may not realize it, but our ankles are actually constantly firing when you're standing up. If you're tipping back just a little bit, it's your ankles that kick in to bring you forwards, and same thing forwards and backwards. So if you're standing outside and a gust of wind comes, that's where those ankles kick in to bring you back to center. Studies show that in static standing, without moving, we're continually using our ankle strategies to keep us centered. In fact, they're the chosen strategy for more than 90% of the time. In other words, our ankles are so important for our balance. Okay, so what limits our ankle strategies? Well, we have range of motion, limited strength, and limited proprioceptive feedback. And we'll touch on all 3 of those, okay? So we don't really realize it, but our ankle range of motion is necessary for postural stability because we need to keep our feet planted on the floor, all right? If I bend down to, pull up my pants at the toilet, or we do for dressing, our feet have to have, our ankles have to have that range of motion to stay planted to keep our balance. And so not only statically, but that, is the next point here, it's for dynamic balance. When we walk, that trailing leg and back needs 10 degrees of dorsiflexion. That's lifting those toes up for foot clearance. Okay, so we need the ankles, the range of motion there for our balance. We don't always realize it, but it's pretty essential here. And so anybody that does not have full range of motion in their ankles, if they're limited for any reason, they're automatically at a higher risk for falls because of that alone. And then alongside that, we need ankle strength. Okay, so once again, if I'm tipping back, I need the strength in my ankles to pull me back forwards again. So that way I can become recentered. Studies show that ankle plantar flexion and dorsiflexion, that's basically bringing those toes down and up, the strength of that is an independent predictor of functional independence. Another study, the strength of the ankle plantar flexors and eversion range of motion, that's kind of bringing that foot in and out, is significantly correlated with balance stability. So once again, if an individual has weak ankles, or even one weak ankle where they're tipping back and they don't have the strength to bring themselves forwards, they're automatically at a higher risk for falls. So who knew that? People don't really realize that their ankle strength and range of motion actually plays a huge part in balance. Okay, so our second line of defense actually comes from the hips. Okay, so when do we use a hip strategy, right? Well, when we have a greater loss of balance, so powerful, like you're standing outside and that gust of wind's a little bit more powerful, that the ankle strategies fail us, our hip strategies kick in second. And we do that by sticking our butt out, like we catch ourselves. You can think of a tightrope walker as well as an example. But while a hip strategy is effective, it's not as efficient as an ankle strategy, which is why those ankle strategies are so important and why we kick them in first. Our third strategy, real quick, is a stepping strategy. Obviously, if you lose your balance to the point that it's further than an ankle, a hip, we step to get our balance. It's our last line of defense. We do lateral, forwards, backwards, crossover. Those are some of the stepping strategies that we use. Now, a free resource, if you want to learn more about the strategies, if that was pretty fast, is on YouTube, Little Steps, Big Gains, free. Everything's free on my YouTube channel. If you want to learn more, it's called Balance Strategies, if you want to re-listen for more detail. However, now the question is, how does Parkinson's disease specifically affect those three balance strategies? That's kind of what we're here to learn a little bit more about. So basically, studies show that Parkinson's disease results in three things. So first is an inhibition of postural responses, where those reactions are either absent or diminished in their amplitude. Second is an inefficiency of postural adjustments, where we have an abnormal pattern, and we'll talk about that. We'll talk about all three of these. And then the third thing we'll talk about is an inflexibility in the postural patterns. In other words, modifying or changing those postural patterns when we need to. We need to be flexible to choose or change the correct, most efficient balance response. Okay, so that first one, the inhibition of postural responses, a lot of information. You'll get the recording here. But once again, with Parkinson's, sometimes we have a compromised, absent, or diminished in amplitude, our responses. An example is the pull test. And this is where a clinician takes an individual and that person is supposed to stand upright and you simply pull them backwards by the hips, over the sternum. And an individual without Parkinson's disease, the first thing that should kick in is the ankles. Some cases, if it's a little bit harder push, the hips, and then occasionally a step, but usually it would be one step back to regain our balance. With Parkinson's disease, strategies there are either absent or diminished, okay? And if we have to take a step, it's multiple steps or a rigid fall into the examiner's arms. That would be the pull test, okay? So secondly, so that was an inhibition. So here we have an inefficiency, okay? So we talked about those patterns, right? It really should be ankles and then hips, okay, when we lose our balance. Individuals with Parkinson's disease often combine those ankles and hips together, or hips and ankles. We're kind of changing up the pattern. And the problem with this is there's an inefficiency there, okay? So we become destabilized easier by just a simple small perturbation. And then third, there is that inflexibility. Okay, so the order of those balance strategies we just talked about, it really does have to be flexible with changes in the surface conditions. Okay, in Parkinson's disease, there's often a lack of flexibility in modifying or changing the motor pattern. They think it's hypothesized that this is due to difficulty sequencing motor programs for postural correction. And once again, this is a lot, but you'll be getting a recording of this video, okay? So in review, when it comes to those balance strategies, ankle hip stepping strategies that we use to regain our balance, unfortunately, Parkinson's disease, the influence it has is those strategies become absent or diminished. There's an inefficiency in the employment of which strategy is used or recruited. And then there's not that flexibility in changing the necessary balance strategy that would be most efficient for that surface condition. Okay, so those are the 3 balance strategies. We're going to keep asking that question of, well, what makes up our balance? Okay, so now we'll talk about the 3 balance sensory systems. Okay, 3 systems that integrate for our balance. So in order to maintain our balance, our brain needs one important thing, and that's communication. It needs these constant status updates on the position of our body within itself and the environment around us. And so where does the brain get all this communication, this information? And it comes from our 3 sensory systems. And that would be the visual system, feedback from the eyes, the somatosensory system, feedback from the limbs, and the vestibular system, which is feedback. It's in the inner ear. It is a balance system that we have. We'll break those down really briefly. Oh, I'm so disappointed. My pictures are not popping up. So there is a whole video dedicated to this on Little Steps, Big Gains, specifically on the balance strategy or systems, if you want to learn more about them. Okay. All right, so let's keep going here. The visual system. So when it comes to our balance, our eyes are continually providing feedback or information to the brain about where we are relative to our environment around us, okay? So if you're tipping forwards, your eyes are telling your brain, hey, you're falling. And then the brain gets that information so that it can respond, okay? And this isn't just when people think, visual system, they think of static visual acuity and, what's my clarity or acuity of vision when my eyes are stationary. But there are other components, dynamic visual acuity during head turns, or the coordination of our eye muscles, which is called ocular motor coordination or control, where we're tracking objects or jumping back and forth. The eyes can come together for depth perception. And we'll talk about how Parkinson's disease affects the visual system. Okay. The second system briefly is the somatosensory system. Okay. So when it comes to our balance, our limbs give information to our brain through tactile input. Think about the bottom of your feet, touch, pressure, and vibration. 70% of information when we walk is from vibration. And then proprioceptive input. This is from the limbs themselves, the joints, the position sense that we have. So as an example, if we're tipping back, the pressure in the heels, right, that tactile pressure, along with the change in the angle of the ankle together combine and tell the brain, you are tipping backwards. You need to respond, okay? That is your somatosensory system. Oh, I'm so disappointed. There is a picture right here, but it is, there's a video specifically on the role of the somatosensory system, specific to that. Okay, we'll keep going here. So the third system, briefly, this is an overwhelming one, is the vestibular system. But overall, basically, it is a balance system in the inner ear, okay? And it tells the brain about the orientation of our head, relationship in its relation to gravity around us, okay? 3 functions are, it controls our posture to tell our brain about our spatial orientation, where we are, coordinates the movement between our head and our body, and then stabilizes our gaze during dynamic head turns, which is, essential for our day-to-day tasks. So an example here would be, once again, if we're bending down to pick up our pants, like at the toilet or something, or getting dressed, our head position changes, right? We're now in a horizontal position for gravity. And that change of head position is going to kind of talk to our brain and tell our brain where we are throughout the entire positional change so that our brain can get those status updates and respond and keep us balanced. Okay. Oh, here's a picture. Okay, so this is an example of one of the pictures I had on Little Steps, Big Gains, free the keyword is free, there are videos on the role of the vestibular system. So there's one on the somatosensory, one on the visual system. Okay. Here's that other picture. Okay. You can always find if you want to learn more about these. Okay, so now the question why we're here is, how does Parkinson's disease affect these balance systems? Okay, well, let's talk briefly visual changes. Parkinson's disease, its influence on the visual system. Very often there is a decrease of what is called contrast sensitivity. That is the ability to discriminate an object from its background. Studies show that individuals with Parkinson's disease have struggled or do struggle with contrast sensitivity. Color vision, peripheral vision may be affected, motion and social perception. And when I say motion perception, that's not only object motion perception, which is usually more difficulty detecting direction than speed, but also biological motion detection. In other words, a human movement. Okay, spatial orientation, once again, kind of where things are in space. Ocular motor control and double vision is more common than we think with Parkinson's disease. It's just often not really reported because it comes and goes. So sometimes people are at the neurologists or movement disorder specialists, and they don't necessarily bring it up, but double vision is actually more common than we know. And if you want to learn more about the visual impairments, there's 2 videos for free. You can always click on them on Little Steps, Big Gains. Okay, the somatosensory system, okay, in Parkinson's disease, studies show an increased threshold for perceiving proprioceptive signals, okay? This is associated with somatosensory abnormalities, such as joint position sense errors, impaired lower limb tactile and proprioceptive sensation, and then difficulty perceiving small changes in surface inclination. So think about ramps and things like that, or uneven surfaces. If you're going over sidewalks, maybe one sidewalk is a little bit slanted than the other. That's a small change in surface inclination, but it can really make things more difficult for individuals who have Parkinson's disease. And okay, so in terms of perceptual orientation, basal ganglia dysfunction in patients with Parkinson's disease may result in 2 things, okay? Impaired perception of limit of stability, and we'll talk about that. Impaired perception of verticality, and we'll talk about that here, okay? So limit of stability. That is basically how far can you sway without falling over, okay? They call that a cone of stability, all right? You're swaying from the center. Our central nervous system has an internal representation of our limit of stability, okay? Basal ganglia dysfunction in Parkinson's disease may result in an abnormal representation of our limit of stability. This can interfere with movements towards the limit of stability, okay, especially the forwards direction. That contributes, there's many reasons, but that also will contribute to that leaning backwards. That's very typical, that retropulsion. And it has a huge contributing factor to fear of falling, okay? Secondly, there's an alteration of the perception of verticality. Verticality, that's our internal representation of what is up and what is down, okay? So Parkinson's disease may actually result in an altered sense of this to the point that our verticality is either tilted or inaccurate. This obviously impairs postural alignment. It contributes to difficulty, once again, navigating things like ramps and inclines, increases our risk for falls, and intensifies our fear of falling. Also think about that retropulsion, that leaning back. A lot of it has to do with this verticality. Okay, so in review, basal ganglia dysfunction impairs perception of limit of stability, horizontal around us, and vertical, upright around us. Okay, here's more videos. Let's talk balance. Let's talk posture for mobility and balance. If you're looking for more information, because I'm going very, very fast. Okay, so here in part 1, we discussed the balanced strategies and systems that contribute to postural control, and then more specifically, how Parkinson's disease affects each one of these strategies and these systems. So I hope that you found part 1 informative or educational. And part 2, we're going to discuss skilled interventions to address these specific impairments. Okay, and for those who have questions, please write them down. We can revisit them. I just need to make sure we cover all of our contents. But because that was a lot of content, we're going to take a therapeutic rest break. And if you want, you can join in on some Tai Chi inspired movements, okay? Now, while I am Tai Chi certified, these movements are more Tai Chi inspired, okay? We're kind of modifying things, make it a little bit easier than some Tai Chi movements. And we're going to add a few components that's more custom for Parkinson's disease specifically, okay? Lateral weight shifting, we'll talk about why that's so important for Parkinson's disease later on. And posture, obviously we need posture for alignment, and that'll help us kind of with things like balance, walking, freezing, okay? So if everyone wants to join in, if you want to, you can do this in sitting or standing, okay? Whatever you feel more comfortable with. I'm going to back up and sit on the bed so you can see. There is a video on this. It's basically 5 moves. That's it. But you can repeat the moves however you want. We're going to learn the 5 moves. First, we'll learn 3 of them, and then we'll talk a little bit, and then we'll come back and learn 2 of them, and then we'll put it together. Okay. But if this is a lot, there's more information. Okay. Now you can see I do have 3 pups back here. So the first thing we do is just called the good morning stretch. Okay. Our hands are together, and feel free to watch or participate. Okay. So what we do is we breathe in and we go up all the way. Okay, this feels good. Breathe out slowly down around, opening up that chest. This should feel good. And then back to center. That's the good morning stretch. We're going to do it 2 more times, okay? We're breathing in and up, down, blow out. Oh my gosh, it feels so good. All right, 1 more. Breathing in and up. Breathe out, around and down. And that was the good morning stretch. It's the way we warm up and the way we'll cool down. Okay, now we go into lateral weight shifting. And in part 2, we're going to talk about why lateral weight shifting is so good for Parkinson's disease. Okay, but what we do is this is called hold the ball. One arm is going to be on top and one arm is on bottom, like you're holding a ball. Okay, so we're going to shift our weight onto one side. Pick whatever side feels comfortable to you. People are right-handed, often go to the right, their right, but you're shifted your weight. The outside arm is on top and the inside arm is on bottom, like you're holding a ball. Okay. And that's how we start. Okay. So we breathe in, and as we breathe out, we're going to start rolling the ball, and then keep going and roll it the other way. And now your weight is shifted onto your opposite hip bone, or if you're standing, it's on the outside foot. Okay. We breathe in, and then we shift back to center as we're breathing out and come back to our start. That's it. We're going to do it 2 more times. So we breathe in, breathe out. Now that outside arm is on top. Breathing in, breathing out. Good. So that's hold the ball. That's hold the ball. All right. And then our last one that we're going to go ahead and do is called draw the sword. So hold the ball is for lateral weight shifting. Draw the sword is for posture. Okay. So both hands are going to start kind of near your pocket. It's almost like you're holding a little ball. Okay. And that top arm, you're going to draw the sword. So we're going to breathe in up across your body, like draw the sword. Oh my goodness. Open up that chest, those pec muscles, and then breathe out and put that sword back in. Okay. Now we have to switch, right? So go ahead and switch those hands. I know you can't really see really well here, but that top hand, Go ahead, breathe in, open it up on a diagonal, draw that sword. We are opening up that chest, squeezing that scapula, and then we breathe out and put that sword back into our pocket. We're going to switch. Okay. Breathe in, open up. Feels so good. Okay. Breathe out, put that sword back into the pocket. And then we're going to switch. Breathe in. Feels so good. Breathe out. Okay. And those were the first 3 moves. And if you're thinking, oh, I don't know the benefit of that. Oh, we'll talk about the benefit. Okay. So I'm coming back again. Okay, wonderful. So once again, there is a whole video that you can go through if you want to review on that, but we just did the good morning stretch, hold the ball, and then draw the sword. Okay, so here in part 1, we discussed the balance strategies and systems that contributed to our postural control and how Parkinson's disease affected these, right? Now we're going to transition to interventions to address these impairments, which is why, all right, now we know what we're struggling with. What do we do about it, right? That's why we're here, right? So real quick, we'll kind of run through these evidence-based interventions to maintain our range of motion of the ankles, right? And our ankle strength. That's going to help with our ankle strategies. Pelvic range of motion. That's going to help with the hips. Lateral and square stepping. We're going to talk about that and how good that is for Parkinson's disease. Somatosensory focused balance training, big words, but we'll talk about that for Parkinson's disease. Other evidence-based interventions, dance, karate, Tai-Chi walking, boxing, LSVT BIG, and walking, both free walking and Nordic walking. And next to each one of those is a little number because I have all the resources and references that supports that to be, have evidence to support it for Parkinson's disease. So briefly, okay, those ankle range of motion, things that people can do every day to maintain that is calf stretches on the wall. You can hang your ankles off a step. In sitting, you can take a strap or a towel around the top of the foot and pull it back towards you. You can roll your ankle around on a ball. But if somebody's struggling with ankle range of motion, especially women who used to wear high heels their whole life and then come to us for therapy, every day working on that ankle range of motion. Okay. All of this is in a video if you're like, oh my gosh, you talk so fast. Okay. Ankle strength, calf raises. After you stretch them out, do some calf raises. Ankle pumps and sitting would be really good with or without an elastic band. You can do sit to stand transfers. In other words, getting up and down, but put your feet on an incline, okay? They have wedges or something under the top of the foot, like a broomstick, and stand up and down, up and down. Oh my goodness, you're gonna find that your body wants to tip back. So you're gonna have to use your ankle strategies to keep yourself forwards. We'll talk about wall falls and ice cream cones as another option. And first is the wall fall. If you want the full video, it's there for free. But to do a wall fall, usually I have people stand about a foot away from a wall or a corner if you feel comfortable, maybe having a walker or chair in front. And then what we do here is we keep our body straight and you tip your body back like you're going to fall into the wall, but don't. Use your ankles to bring yourself back up again. Okay? And then you go to tip back, but don't tip and come forwards. And you're basically practicing that balance retrieval. You're practicing an ankle strategy over and over and over, strengthening those ankles. And then that kind of correlates and applies into real life, standing at the sink and things like that, washing the dishes. You start to lose your balance. Your ankles are faster and stronger at bringing yourself back up again. Okay, pelvic range of motion. Here we go with cross body reaching. A lot of people here do boxing, which is so good. Boxing across the body, across midline. Side bending. A lot of people, unfortunately, may experience lateral trunk flexion in terms of posture. So really doing a lot of side bending the opposite way, opening up the rib cage. When I say hula hooping, I'm not saying grab a real hula hoop as much as taking those hips and warming up. You know, sometimes sometimes people warm up and put their hands on their hips and just really work that pelvis around, loosen it up. Okay, so that would be the ankle and hip strategies. Now, stepping strategies, incorporating lunges. Okay, if you're boxing, incorporate that step, punch, all of those things. Clock stepping, that's where you can stand in the middle and keep your middle foot planted or one foot planted like it's going to be in the center of the clock. Take your opposite foot and go ahead and lunge into a 12 o'clock position. So your one leg is forwards, right? Come back, 1 o'clock, 2 o'clock, 3 o'clock. So maybe every day add lunges in all directions, doing clock stepping, okay? And then here's 2 evidence-based interventions with some research studies that I'll go through with you on lateral side stepping, okay, and something called square stepping. Now, if you're a nerd like I am, you're gonna hopefully enjoy the actual research studies I'm gonna review with you. And if you just wanna know, all right, just tell me the conclusion or the result, we'll get there too. Okay, so here's a study that compared, in terms of stepping strategies, side stepping, crossover stepping, or no stepping in Parkinson's disease. Which one of these is the most effective? And you may have your hypothesis, but hang in there with me. So they had 14 individuals without Parkinson's disease and 13 individuals 14 with Parkinson's and 13 without. Okay, so basically, conclusion number 1, crossover stepping. It's ineffective. And you're probably saying, well, duh. Okay. But in case you're a nerd and you want to know, or you're curious, for control subjects, 30% of people chose this strategy. In other words, they used the crossover to get their balance and they didn't have any falls. People with Parkinson's disease, surprisingly, 29% of people that were off their medications tried this. And 15% on medications chose and tried this. There was 75% of them failed and had a fall in the trials off the medication and 30% on trial. So obviously it was not a good strategy to choose. And you may be saying, well, duh, but we'll continue about why this is important. All right, conclusion number 2, the no stepping strategy was really ineffective and shouldn't be attempted for somebody with Parkinson's disease. Just so for information, control subjects, nobody chose this. Everyone chose to step. However, they had no falls. People with Parkinson's disease, 14% of people off medication tried this. Like, I'm not going to step to keep my balance. And 12% on medication chose this. In terms of falls, 100% of the time, individuals had a fall. So this was definitely, we need to step to get our balance. Okay, so here's the final one, sidestepping. Okay, the conclusion, it was the safest, most effective response. With control subjects, when people lost their balance, 70% chose the sidestepping routine, okay? And they only had 1 fall. In Parkinson's disease, 67% of people off their meds and 73% off medication chose this. I'm going to do the side step. And there was only 17% falls on meds and 14% off meds. And if that's a lot of information and now you're the kind of person that's like, just tell me what the results or conclusion is. Well, here we go. The takeaway. Individuals with Parkinson's disease, we really should practice recruiting and employing sidestepping because that is the most effective, successful strategy to regain our balance. So for therapists and medical professionals, since lateral sidestepping is the most successful strategy, therapists should be reinforcing that strategy in therapy over and over because this is the best route that people have, individuals with Parkinson's, most successful route to prevent a fall. So therapists really need to practice really reinforcing this larger lateral weight shifting and faster step initiation. And so now you see why lateral weight shifting is also really good, some of our Tai-Chi moves. Okay, so other options for lateral weight shifting. Tai-Chi, obviously. Okay. One of the things we did was hold the ball and we'll go over blocking face, but those are lateral weight shifting exercises. A shift and lift is basically where you have all your weight, you shift it onto one leg, take the opposite leg and lift the heel. Okay. Shift your weight to the other foot and lift the opposite heel. Shifting your weight, that's the shift and lift. Ice cream cones, very similar to wall falls, but now instead of going back, you're just making a circle, okay, with your weight. Single leg stance, very, very effective. Just focusing on the shifting all of your weight onto one leg, okay? There is, if you're interested in learning or taking on exercises outside, there is a 30-day static standing balance challenge that incorporates a lot of lateral weight shifting. Okay. All right. So that's weight shifting. Now let's talk about stepping exercises. There's research to support metronome paced stepping practice. Okay. So I have people sidestepping along their countertop or the parallel bars to a beat. Okay. Let's put the beat on and march to the beat, sidestepping. Okay. Repetitive training. That's what therapists really should be pulling and pushing people to practice. Shift and step. Okay. You're on one foot. Slowly shift your weight inward, and at the last second, use the internal foot to catch yourself. Of course, you have to be careful with this. Boxing, include your sidestepping with boxing, okay? Step buck, or punch. And then ducking, okay? You're on one side, duck and shift, or duck and step, okay? All right, so that's stepping. Now, what the heck is square stepping? Okay, square stepping is actually a protocol, and it was founded in Japan, and it involves an exercise mat with 40 25 centimeter squares, okay? And there's 6 patterns on it, 2 elementary, 2 that are intermediate, and 2 that are advanced. Okay, we'll get through why I'm bringing this up with you. Because first off, research shows that square stepping is extremely effective for leg strength, balance, and gait. Well, that's great. That's for the older adult. But what about Parkinson's disease? Is square stepping a great route for Parkinson's disease? And absolutely. So here's one study. The aim of the study was to analyze the effect of square stepping amongst individuals with Parkinson's disease in terms of improving balance. So they had 30 males and females between the ages of 60 and 70, and they had 2 groups. One group did conventional physiotherapy, okay? The other group just did square stepping exercises, and they did it for 4 weeks, okay? The conventional group, they did backwards walking, sideways, forwards, high knees, long steps, arm swings, turning, pivoting. They did a whole bunch of really cool interventions. And then the square stepping group only did 2 patterns, and we'll talk about what patterns they did, okay? The results for the square stepping group actually had significant improvements compared to the conventional group. So the conclusion was that square stepping is actually more effective in improving balance and gait in Parkinson's disease. So that's cool, but what were these patterns? That's what I wanted to know. So they did elementary pattern 1 and 2. And the top one up there is elementary pattern 1. They just had squares and just practiced stepping in those squares. Okay. Elementary pattern 2 is on the bottom there. Okay. So it's kind of an in, out, in, out, in. And what these individuals did is they repeated the sequence down, walked normally back to the front of the mat, went down again, around and around. So they repeated it 3 times. They did it 5 times a week for 4 weeks. That's what they did. So it's this whole stepping pattern. There's a whole video on it. If you want to learn more specifics, I talk about the size of the mat, further details, but all these videos are free. Okay. Free. There's also a whole 30-day Tai-Chi inspired balance challenge. And this balance program focuses a lot on stepping strategies. Okay. All right. So that's great to improve our strategies, our ankle hip stepping strategies. Now, what about those balance systems? Well, there's a lot of research to support what is called somatosensory-based balance training. Okay. So the proprioceptive system is responsive to exercise training. That's the exciting thing. However, the type of training is critical to inducing improvement. And this is because the ability to perceive our joint motion is actually impaired mostly at slow instead of fast speeds. Okay. So if I go to reach into a cabinet, if I reach fast, okay, my proprioceptive system, my limb went so fast that the brain wasn't getting, didn't need as much signals on the way, right? But if I have to reach slowly or step slowly, okay, that requires a lot more loading on that proprioceptive system the entire way. So in order to challenge the proprioceptive system, we really need to go slow. All right. And if you're already thinking, wait a minute, I know something that's focused on being slow, Tai Chi. You're absolutely right. The studies show that Tai Chi has a strong relationship to proprioceptive ability and an ability to increase joint position sense. Okay. It generates high magnitude of somatosensory feedback. And so there's a lot of research to support Tai Chi for Parkinson's disease. And if you remember what I had mentioned, that studies show that there tends to be joint position sense errors with Parkinson's disease. Well, if Tai Chi improves joint position sense, you can see why the research supports Tai Chi as being effective for balance with Parkinson's disease. That is why. Okay. Yoga and Pilates are also fantastic. Okay. So any exercise that imposes a focused attention on somatosensory inputs can be very effective. So some examples would be closing the eyes, because now you're forcing the brain to use the feedback on the feet instead of the eyes. Therapists will distort vision, wall falls we talked about, standing on one leg, short foot exercises. There's videos on that. I can go through that with you. And then whole body vibration. Now, what about specifically for Parkinson's disease? Here is a research article called Better Balance with Somatosensory Exercises. This is called, it was called a Parkinson perspective. So this study did imposed focus attention on somatosensory input, okay, for maintaining balance control. They had 2 sessions of 45 minutes a week for 8 weeks. And the outcomes were that individuals, this was with early Parkinson's disease, and you'll see why, because the exercises are pretty advanced, but improved their balance after the intervention. If you want to know what they did, here's a list. And the actual research article is pictures of what they did as well. And you can come back and read it. But it was things like tug of war, balancing on a trampoline. You can see why it was more younger onset Parkinson's. Okay. One more research article. So this article looked at the contribution of somatosensory feedback during, for exercise with Parkinson's disease. And they looked at treadmill. So one group focused on fast. This was the rate group, okay? Because the hypothesis was if we walk faster, we're going to increase the rate of somatosensory afferent input. The second group focused on magnitude. So let's put more weight on our ankles, okay? This is going to, the hypothesis here is this is going to increase, make a greater signal from somatosensory receptors. And then the third group had no intervention. So you walk fast and they didn't have ankle weights. Well, all the treadmill groups, the good news is they all trained at the same aerobic intensity, duration, and frequency, but only the rate group, that was the fast group, actually had improved in the primary outcome measures. So this study demonstrates that exercise that generates a high rate of somatosensory feedback appears to be the most capable of improving motor symptoms of Parkinson's disease. So the takeaway is try to increase your walking speed, all right? Or intervals. Walk really, really fast for an interval and then slow it down. But very interesting, at least I thought so. Okay, once again, there's a free, this program not only does lunges, but power lunges, okay? You can incorporate power lunges where you lunge, hold that position, hold onto a chair if you need to, and then using power, take that front foot, whether it's in front, sideways, or backwards, and push off it to come back to center again, okay? Those are your power muscle fibers. That's using that proprioceptive input to push off, okay? Another 30-day program for free. Okay. Other evidence-based interventions, this includes dance, karate, Tai Chi walking, boxing, LSVT BIG, and then walking. Okay. So here in part 2, we discussed some evidence-based interventions to combat balance loss with those ankle hip stepping strategies, those sensory systems. I hope that you found part 2 informative and are educational. In part 3, I'm just going to give you some free resources. So we're just going to learn 2 more moves, okay? So the first one is just cross-body reaching. So our hands are up, okay? Like I surrender. Okay, so this is beautiful. We take a deep breath in and then take one hand, only one. You're going to breathe out, reach it forwards and across your body. At the end, you're going to flip the palm, facing it in now. And we're going to breathe in and return to center. Beautiful. And now you probably know what's next. Take the opposite hand. Breathe out, reach across. All the way. Flip the palm. Breathe in and bring it back in. Beautiful. We're going to do that again. Breathe out and reach all the way across the body. Make it big, right? Big movements. Turn the hands, bring it in. Okay. The other arm, breathing out across the body. Flip it and bring it in. Okay. That was just a cross body reach. We only have one more. Okay. That's 5 moves. And this one is going to incorporate lateral weight shifting, which is really important for Parkinson's disease, and posture. Okay. So when we did hold the ball, we were holding the ball. Very similar, but now we're going to do blocking face. So that outside arm is now blocking the face on the forehead. Palm is facing out. Okay. And the elbow is back. And when you bring your elbow back, you should feel how that influences your posture. Okay. The inside arm is facing the belly. All right, so that's the 2 moves. Your top arm is facing, palm is facing forwards and out. The inside arm is on the belly. That's the arms. And then we shift our weight all the way to one side. Okay, we breathe in. And then as you shift your weight, you start to switch your hands. Okay, you switch. Oh, goodness, get that elbow back. When you put your elbow back, you feel how that influences that scapula back, that posture. All right, we breathe in. And when we breathe out, we switch and shift back to our starting position. Okay, we breathe in again. We shift our weight, lateral weight shifting, and then posture, bring that elbow back. This also opens the rib cage. Breathing in, and then when you breathe out, you shift and switch, okay? Think about that rib cage on the outside. Individuals with Parkinson's disease, sometimes we have a lateral side bend posture. So think about how good that is for opening up the rib cage, bringing that scapula back, stretching out those pecs, and that lateral. So you kind of combine those things and it's fantastic for Parkinson's disease. So those were the 5 moves. We will review all 5 afterwards. But once again, if you're like, oh my gosh, that's a lot, there's a whole video for free that you can review or you can rewatch this recording. Okay. So last but not least, for part 3, which is pretty fast here, we did cross-body reach and blocking face. So here we are about free resources, okay? Now I did mention tips for preventing freezing and tips for freezing, and I'm happy to go over some tips. I just wanted to make sure when I was rehearsing this that we cover all of our content. So if you want to have tips for tremors, tips for speech, this is with a speech therapist, tips for standing balance, core strengthening, posture. 30-day programs I've had such good feedback about core stability and posture with these. Standing balance, there's programs. The 30-day household hustle, I'm finishing that up. That should come in 2 weeks. It's going to be exciting. And then there's all sorts of balance sessions. So all sorts of free things if you're looking for home balance or education. If you hear me say in the videos, please like, subscribe, share. The only reason I do this little blurb just to tell you why is I learned that YouTube doesn't recognize videos to share them or populate them if they don't have activity like likes or subscribers. So if a person were to search, balance systems for Parkinson's disease, somebody like me, the video would be completely hidden and bigger people, their videos would show. So that's the reason why YouTubers will say like, subscribe, share, just so that we don't get buried in case it's not about popularity. It's more about accessibility. And then there is Patreon. Patreon is very common amongst YouTubers. It's just an opportunity if you want to support somebody, $1 a month. For $8, I have meditations, mental health stuff. For $15, we do get-togethers. So that's just there. So this was the last part of it, was just to review all 5 exercises. And you're like, wait, there's 6 there. It's because the good morning stretch ends the whole thing. Okay. So I'll stop sharing. Okay. And if you're struggling with the transitions going from one move to the next move, you're not alone. It's going to feel awkward. And the reason why it's a 5-minute thing is sometimes I tell people to put music on in the background and just go through these moves for 5 minutes. Okay. So let me come back. It's up to you if you want to jump in. It's just nice to do this between all of that information. Okay, so I'm going to do each move with you 2 times, and then we'll transition to the next move. So if you remember, our first move is the good morning stretch, one of the best ones. So we breathe in, breathe out, around and down. Should feel good. Open everything up. Okay, back to center. We're going to do it again. Breathing in, making sure everything is big, right? We don't want small movements. We want big movements. All right, lateral weight shifting. So now we're going to go to hold the ball. All your weight is on one side. You're holding a ball. The outside arm is on top. Okay, we breathe in, and then you shift your weight to the other side. Okay, lateral weight shifting. Breathing in, breathing out, back to the start. One more time, lateral weight shifting, breathing in, shifting and switching. Breathing in, shifting, switching. Okay, now we go straight to draw the sword. So you switch your hands, the top arm, draw the sword with me, breathing in. So now we go back to posture. How good does that feel? Bring it down. Okay, and you breathe out. Now we're going to switch sides. Okay, so now your other arm, it breathes in, you breathe in, not your arm. You stretch everything out, and then we breathe out. Okay, we switch again. Think about for Parkinson's disease, we need that open up the rib cage. Okay, the rib cage here, we need to expand that diaphragm, that posture, bring it down. Okay, and then one more, we switch sides, breathing in and out. Okay, now bring those hands up like I surrender, because we're going to do our cross body reaching. Okay, so take one hand, breathe in first, breathe out, reach across the body. Okay, flip the hands, breathe in and return. Now I think we're going to breathe out, take the other arm, reach across when you breathe out, flip the wrist, breathe in. One more time, outside the other arm, I should say. Breathe out and then reach. And remember, we want to really reach. We want to expand, almost pull that arm out of the socket. Breathe in, come back to center. One more time, the other arm. We breathe out and reach. This is so good for all of us. We breathe in and we come back to center. Now blocking face, that arm that you just brought up, bring it to the forehead. Take the other arm, bring it to the belly. Okay. Remember that elbow is back. Oh my gosh, that should open up the rib cage in the posture. We breathe in, and then as you breathe out, start to switch those hands, right? Okay. Elbow back. Oh, feel that. Oof. Okay. We breathe in, and then we shift the weights, lateral weight shifting and switching. Every day, posture and balance. We breathe in, we shift, switch. So good for us. Good for everyone. Breathing in, shift, and switch. And then we bring that top arm around. We're going to go back into good morning stretch, right? Oh my gosh, this is so good. We breathe in. Maybe you feel a little looser now. Breathe out around. We have to combat stiffness, right? Stiffness is a really limiting factor. And we breathe in, breathe out, around and down. And all of that movement on the rib cage is going to free up our diaphragm for when we have a hard time breathing. Everything's closed. Now everything's open. Every day, put on some music, go through the routine, 5 minutes, and it feels so good for balance, postural stability, breathing, all of those fun things. So, okay, that was that. And so for anybody that's curious, at the end of the PowerPoint, you can see all of these research articles to support everything. There's a few pages of them, all of those. And then a review of free. Please know that everything's free, okay? And more free. And then a thank you and a Q&A. Fantastic question. So in Japan, and the problem with that is, and this is what I'm not happy about, is technically you're supposed to be like a medical provider, and that has a certification. And so what I did is I took if you saw my picture there, I actually purchased a exercise mat, a black one, and I can give you the measurements of it. And I took yellow tape and I put yellow tape down. And that's what I did. In our gym, we have little ladders. We have agility dots that we use they're colored agility dots. When I've done home health with people, I've taken tape and put it on the floor. I've also put tape down into patterns. And so you don't necessarily need to buy the mat as much as use the concepts of that, where I have people go, okay, ready, in, out, step forwards, in, out, back and forth, because the actual mat itself, I don't know how to convert Japanese money, but you have to be a provider. So that's an unfortunate answer, but a workaround that we do in our gym, and then what I've done with people in their home. Great question. Well, the actual exercise study, the actual protocol does have them being 25 centimeters. And I can give you the measurements of the actual mat itself. The one I purchased was like 3 foot by 8 foot to make those 40-inch squares. But to be honest, when I work with people, I more or less focus on the patterns in the motor planning of it. And if you can see the research on why, if that lateral stepping strategy is what we need most, and that translates to freezing as well, where we can shift our weight from side to side. So it's more of the motor, the planning, the sequencing, that rehearsal than it is. And I will add a metronome to it with people where, okay, put that metronome on, put that beat on, put a music on, a song, and then go to the music, out, in, forwards, out, in, out. And, I know you guys are in a gym, and I don't know if there's a place on the floor to put tape or just to really practice that sequencing. But I kind of combine it. So what I do with people with wall falls is I have them go to either a wall or a corner based on their balance. Sometimes people feel more comfortable with a corner behind them because they have something on both sides. And then I always recommend safety first. So maybe having a walker or a chair in front. So you are basically at boundaries on all sides that you're not going to get hurt. So after they step back into the corner or the wall, I then have them take maybe a one step forwards where they're maybe 2 to 3 inches away, where you can't feel the wall. You're not touching it, but it's close enough that when you do lose your balance, because you will with practice, the wall's right there. Okay. And so we stay as stiff as a board. I say kind of pretend like you're a tree. Okay. And you're going to sway in the winds. You're going to sway backwards, but you're not going to sway so far that you fall into the wall. We don't want that. We just want to sway back. So your pressure's on your heels. And then when you go as far as you can, right before you're going to tip, come back to center. So I say you're a tree planted or swaying in the wind is what I say, but rooted in the ground. Okay. Something's behind you. It's your opportunity to practice swaying back and then using your ankle strength and as well as the pressure in your heels, that proprioceptive loading for the brain to bring yourself back forwards again. Okay. And this reinforces what I call the default position, where I have people, even before they start a wall fall, I want you to pretend like you're standing on mud. And I want you to center yourself where your heels are not sinking into the mud, your toes are not sinking into the mud, but you're centered. Okay. That's your default position. Start there. Then shift your weight onto the heels. So your heels are sinking into your mud and then come back forwards. And it really helps with that verticality, what is upright, the limit of stability. So that would be the wall fall. And there is a video on it. And then an ice cream cone is very similar, but now you're going in all directions. So you're not just swaying back, but now come to center and then sway all the way to the right, center, forwards, center, left, center, back. Just have to be careful because you need something on the side so you don't fall, but that would be going in all directions. And then when you kind of get the hang of that, you do the ice cream cone where you start in back and you sway to the right, forwards, left, back to center, like an ice cream cone. That is called your cone of stability. And you're rehearsing that and trying to increase your cone of stability.